This is Dr. Anderson. I'm going to give a little bit of information on how chronic pain pathways occur in a typical chronic pain patient. We will start with drawing a representation of a human. As you can see, things aren't exactly to scale, but the illustration will work. For the purposes of this discussion, we will make the pain somewhere here in the low back, and we will represent it as a pink oval. It could be any place of chronic pain, the knees, the neck, the back, etc. The region of the chronic pain has a bunch of nerves that connect to it. Those nerves can sense that there are problems in that region, and they begin to fire pain signals. The local nerves then send the signals up the spinal cord up to a region called the periaqueductal gray. That's represented by a tan square in this drawing, although the periaqueductal gray is not actually a specific place, but a region along the upper spinal cord itself. But for this exercise, we will draw it as a tan box. From here, pain goes to your consciousness so that it can be experienced. This does give us many different ways that we can try to block pain. In the region where the original pain began, there are many things that can be done for the pain. Of course, removing the underlying cause through surgery or through other means may help chronic pain, but sometimes the pain will actually take hold and be self-generating, and removing the underlying cause does not always eliminate the chronic pain. Still, that is one of the options here. Another option is to calm the nerve endings that are transmitting the pain. That is one purpose, for example, of steroid injections. Many self-guided treatments, such as exercise and strengthening, also work in the area of the original pain by helping to support that region. For a very long time, we never knew exactly what to do about the spinal pain mechanisms, but as research has moved forward, we have learned quite a bit. We're going to come back to spinal pain mechanisms in a minute because there's a few more fibers to draw, and at that point we'll discuss some of the things that can be done to reduce chronic pain at the level of the spine. It is worth pointing out again that the periaqueductal gray is rather a region over the central nervous system and not a specific location. But for the sake of our example here, we do need to draw it as a specific location for clarity. The periaqueductal gray is one place where opioid pain medications work. Therefore, when someone takes an opioid-based pain medication, this is the region where the opioid receptors are and where the pain is being blocked. Other things also work like opioids. There's been a study done that shows that acupuncture may release natural endorphins, which are our own natural opioids, and acupuncture may therefore work in a similar way to opioid pain medication. Some medications, like clonidine, a blood pressure medication, also look like opioids to our bodies, and therefore can have some pain-killing effects in this region. Treating pain at the level of the conscious experience of the pain can be a little bit difficult. Obviously, there is no medication or surgical procedure that we use to eliminate consciousness. Therefore, the treatments are basically things that help establish our well-being. Psychological treatments, certain types of meditation and exercise, reading a good book, having a good quality of life, and having good sleep are all examples of things that we do to try to reduce the experience of the chronic pain. Perhaps the most unfortunate consequence of the development of chronic pain is the so-called wind-up phenomenon, where the pain nerves actually change their structure and function and better transmit pain than other sensations. This creates a worsening pain syndrome, and that worsening pain syndrome does not always respond as well as hoped to opioid pain medications. Let's talk about what's going on in that case. As it stands now, the pain goes from the pink oval through the blue pain fibers up the spinal cord, through the tan region, and then through the blue fibers towards consciousness where pain is experienced. It would seem simple to be able to just block the pain's transmission with the tan area. And that's what is hoped with opioid pain medications. But chronic pain patients know that the opioids do not eliminate all the pain. And there's a reason for that. Once chronic pain takes a hold, there are additional changes that go on in the level of the spine and in the spinal cord itself that actually allow for better transmission of pain. Nerves that did not used to transmit pain now transmit pain, and nerves that transmitted pain do an even better job and can even spontaneously fire pain signals even when the original cause is removed. As a simple illustration, you can now see that red fibers have been added. The red fibers represent neuropathic pain, the pain that tends to be electrical, sharp, burning, hot, cold, a feeling of water or wetness, a feeling of zaps and zingers. It's basically the things that nerves can do to transmit pain themselves. Neuropathic pain can be very, very difficult to treat. Also, as I drew in the picture, it tends to not respond to opioids as well, and so I drew the red fibers as going around the tan area to emphasize the fact that the opioids do not do a great job of blocking the red fibers. This means that different types of treatments may be necessary. There are various treatments available to treat the neuropathic pain pathways. However, some of them do not make sense initially. There are blood pressure medications, a few types of antidepressants, seizure medications, and a few muscle relaxants that can help with neuropathic pain. Here is an example of how seizure medications can help with chronic pain. If you imagine an epileptic patient, that is a patient that has seizures, having a number of brain neurons that suddenly fire all at once, causing the seizure. The seizure medication helps prevent that from happening. Now imagine a bunch of pain nerves firing within the spinal cord all at once. And now the same seizure medication may calm those down and help reduce their firing. After all, nerves in the spinal cord may not be that different from nerves up in the brain. Again, please remember that these drawings and this discussion are basically very simplified and not exactly anatomically correct. But I do believe that using these examples can be very helpful to understanding how we do treat chronic pain. Unfortunately, there is even more to this pain pathway, and that is represented here. You may have heard of dorsal column stimulators or the dorsal columns as they relate to pain. The dorsal columns usually are thought of as nerve fibers that take various types of vibratory and specific sensation from our hands and our feet and bring it up to the brain. However, the dorsal columns also have fibers that go down to the spine. As drawn here in green, the fibers go down the spine and they send other nerve fibers over to the pain pathways to block them. Therefore, if we can make the dorsal columns operate better, we can interrupt the flow of the pain coming up to the brain. The dorsal columns run on serotonin and norepinephrine, among other various neurotransmitters. It is believed that some of the antidepressant medications that help with chronic pain may work here. Also important for dorsal column function is good quality sleep. As you can see then, we have outlined 6 different regions where we could try to address your chronic pain. Current research suggests that if we do address the pain at all 6 regions simultaneously, we will do a better job of controlling your chronic pain than if we just tried to treat it at 1 or 2 or 3 of those locations. Of course, that does not mean that we are trying to use 6 different medications or 6 different treatment modalities or 6 different surgeries all at once. In fact, some medications do work at more than one location, and some of the treatments do require things like meditation, exercise, psychology, and other issues that do not require medication at all. There are also procedures that can be performed that can help ease pain as well. I thank you for watching this short introductory video on neuropathic and other forms of chronic pain. I hope the information helps explain why we use various different medications and other treatments and how they work in various different places in the body. In order to provide good communication with patients and good education, I have taken this information and I have greatly simplified it, and I've taken significant liberties with both anatomical and medical information to produce this information here. Although the information is believed correct, please remember that this is not intended to be an exact representation of how pain mechanisms do work. Again, I thank you for watching.